Hi, I'm Tim Rhodes. I'm here with Park Bench, Bowen Island, and I'm here to interview Colleen O'Neill with the Caring Circle Society. Welcome, Colleen. The two questions that you have to ask anybody, first being, how long have you been here? And the second being, how did you get here?
Oh my gosh! I've been here since 1985, and I got here on a second date with this boyfriend who said, I should take you to my piece of land over on Bowen Island. I'd never been. I'm from the Maritimes, so I was like, oh, okay, fine. And he took me to this great piece of land in Seeley Park with this great beach, and we were walking along the beach, and he said, I've bought it, and I'm going to sell it to make some money, a good investment. And I went, no. What if we get married? We might want to live here.
That's so you.
This was our second date. He said, oh, well, okay. I'll hold on to it for the time being.
And you had a third date.
So then we had a third date. Yeah. 30 years later.
You're still on that
still
piece
here.
of property.
Yeah. It was our local milkman. If anybody remembers Richard Goodall when he was delivering milk, he said to me, I don't know, the first year I was on Bowen, he said, you need to really become part of the community in order to make it work here. You got to start volunteering for stuff. And yeah, I took that quite seriously, way too seriously.
You did. You've been involved in a lot of things before this. Describe what Caring Circle Health Resource Center is all about and what you do generally.
Okay. So, you know, Bowen Island's underserved in terms of healthcare, and I just knew over the years, because I'm a retired nurse, I got so many phone calls from people saying, how do I get a nurse? How do I get, are there any doctors? What about a physio? Does anybody know the answer to these questions? And so, long story short, a few of us got together, particularly Diane Marshall, and we decided to write a health resource guide that had all Bowen-specific health information. Once we did that, of course, somebody said, well, this is useless. It's going to be outdated in no time. You need to put it online. So we put it online. And of course, that also wasn't as helpful as we'd hoped because people kept calling me anyway. So I decided in 2014, maybe I'll just open a storefront and see if I can help people one-to-one, help navigate the health system.
Well, that's when you were over by the
Village
Baker.
Yeah. So we opened the doors the first year. I just worked for free, thinking, oh, I'll just do this for 1 month and see if I can get any donations. Of course, well, I got a few, like $20 here or there. But anyway, finally we got government grants, and the municipality brilliantly gave us this space here down at the Heritage Cottage behind the library for free. So that enabled me to be able to work in here, and then all I had to do then was find grants to help with salaries. So after the first year of operations, where everything was volunteer, I now get paid through a government grant, and I see people in here every Monday, Wednesday, Friday from 10 to 4.
So how long have you been open? How long have you been
Since 2014. I think we opened the door March 2014. So 4 years.
Next year's 5 years.
Yes.
Wow.
Yes.
Wow.
Yeah.
So you said you have people kind of Monday, Wednesday, Friday. How busy are your days?
You know, I might only have maybe an average day. It'd be 2 people drop in. What people don't understand, and then I might have 3, 4, or 10 phone calls. So anybody that comes in or has a phone call with 20 questions, it could take me half a day or a week to figure out how to get them nursing at home, how to get them a physio, how to get OT organized, showing them how to order from Stong's because they've never done that before, they don't have a computer, help them get medical equipment, just help them get services that they don't know how to access themselves.
Well, and
so it could take hours for one person.
Well,
Yeah.
And you've kind of not stepped out of, but you've added to that in terms of your Tuesday lunches at the Legion.
Yes, yeah. We got Sky came in, the Seniors Keeping Young group, and they said, you know, we're not getting enough people dropping in, and we're wondering what we could offer that would have more interest, especially from men, because women were going to Sky and their husbands had dropped them off. Meanwhile, they're lonely, and so we thought food, that'll attract men. And women. So a bunch of us, the church, the Little Red Church, Sky, Seniors Keeping Young, the Legion, Snug Cove House, who am I forgetting? The Legion, Snug Cove House, Caring Circle. We all decided to partner because we knew how onerous it would be to try to provide lunch twice a month with just one small group and a few volunteers. So every group provides volunteers and they host different lunches. We got a few small grants, but in large part, the drop-in fee, which is minimal, $5, tends to cover the lunch and paying our chef and our dishwasher with a little bit of community grants in the spring and summer to just top us up.
Wonderful, wonderful.
Yeah.
I guess you've had a lot of kind of heartrending stories you could tell. Whether or not you want to get into that, I don't know. But can you give us some idea of the kind of things people have asked you without trotting on anyone's privacy? Yeah. You know, I think very early on, in fact, Bud Massender, our pharmacist, came to our Caring Circle meetings and was very involved in Caring Circle at the beginning on our board. And he and Stephen Corelli, one of our other local doctors on the island, psychiatrist on the island, used to come to our Caring Circle meetings as well. I remember both of them at one meeting early on saying, "This is great what you do. We really need somebody to do health navigation." By the way, they do it all over the Lower Mainland now, St. Joseph's Hospital, Women's Hospital. I digress a little bit, but all the local hospitals now are having nurse navigators help people get through prostate cancer, breast cancer. The whole navigation of how to get the care you need is way more complicated than it used to be. Anyway, back to local. Both Stephen and Bud said one day, "This is a great Caring Circle, but we need more physicians and we need more primary care here on Bowen. We really need a team of people, an integrated health center where we have not only GPs, but maybe a nurse practitioner. Our community health nurse could be in there so that she could see more people," because I was seeing in here that people weren't, you know, the home care sometimes just does real acute patients because they're so busy. Yeah. So if we had a community health nurse in our health center, could she see more people because they could come to her? So, you know, would we have a physio work out of there? Wouldn't that be great? And maybe it'd be easier for Vancouver Coastal Health to make referrals to physio and OT if there was actually a space. Right now, Vancouver Coastal Health comes here and does the odd chronic disease education thing on asthma, diabetes. This week we're having a COPD, respiratory education seminars for patients here in Bowen, but it's out of here. Yeah. No heating in the winter, it's hot in the summer, the info center's here, so it's noisy. We need a health center where it's not exactly spacious.
No, it's tiny. We need an actual community use room in a health center where we can have health programs be delivered to groups of patients.
And you, in fact, are one of the people that have spearheaded the Bowen Island Health Center Foundation, which sprung out of a health center society that you helped start.
Yes, I did. And if it wasn't for our chair, Tim Rhodes, I would have dropped this project long ago. So thank you, Tim.
Well, my pleasure. It's something Bowen really seems to need and want.
So much.
In terms of the Caring Circle, given that the health center is probably 3 years out, what are your goals over that short period of time for the Caring Circle?
For the Caring Circle. Well, you know, this kind of ties Caring Circle back to the health center, but we're hoping to continue to engage Vancouver Coastal Health, their chronic disease programs, to make sure that they know of Caring Circle now, but I want to make sure that they see how important delivering programs on Bowen, how important that is for patients, because post-heart attack, post-hip replacement, mental health issues, it's really hard for people to get off Bowen. I know people say it's a 20-minute ferry ride, but boy, when you're sick or you've got kids and family, or you're 80 and your wife's 80 and she can't drive you to your rehab for your hip, it would be so important for our healthcare on Bowen to have services here. So anyway, I'm hoping that Caring Circle will continue to advocate on behalf of Bowen Islanders to Vancouver Coastal Health to, at least in the interim, bring programs here despite our modest environment in here. But that will make sure that our partners are staying informed about our gaps in healthcare here in Bowen.
Now, you had a driver's program? Do you still run that?
Yeah, we still run the driver program. I have 25 volunteer drivers, and generally it's for appointments in Vancouver, so it's a big deal.
Yeah.
So I get volunteers that will take people into an appointment in town, wait for them. Sometimes they'll go and buy their groceries while the patient's with the doctor or at Lionsgate having a colonoscopy or something, and then they'll drive them home. It's a real critical program. Like, there's lots of people that don't have someone to drive them home from an eye appointment where cataract surgery. They can drive there, but they won't let them drive home. Or colonoscopy or any like day surgery programs that they won't let you leave the hospital without a companion. So we fill a lot of those critical gaps in our driver program. And the drivers love it. It's they don't have to sign up for so many hours. They just get to do it when it works for them. Oh, I'm going into town anyway. And then the patient pays for the ferry.
So are you looking for any volunteers for any specific tasks at the moment, or are you pretty much subscribed?
I could use more drivers, because every now and then, I'd say probably 1 out of every 6 requests for drives, 6 or 7 requests, I might not be able to fill it. Even though there's 25 drivers, but some people just aren't going into town that week. So I can always use more drivers. And then the lunch program, although each group has a bunch of volunteers, I kind of, for Caring Circle, have the most, but I help other organizations find volunteers. So if anybody wants to help serve at the lunch program, so much fun. Free soup, lots of laughing and joking. It's so much fun.
And so how do people contact you?
Call me at Caring Circle at 9100 or email me at info@caringcircle.ca.
So what's your favorite thing about Bowen Island?
I'm a real people person. So, besides the quiet sitting on my deck when I can't hear any traffic or any noise other than birds, so love that. But I think the biggest, richest thing that would make me sad about leaving Bowen is just how many people we all know that care about our lives.
Yeah.
So if you get sick, I was sick for a while with cancer, and that's when you really get to feel like you're part of an intimate group of people who care. Yeah. Even if they're not your best friends, they drop off flowers at the door, or they hug you in the store, and I hardly know them, going, oh, I hear you going through this, and good luck, and that kind of social connection, which apparently, according to Vancouver Coastal Health Stats, we have the highest sense of community belonging in the whole Vancouver region. And that sense of belonging in a community with people that know you and care about you.
Yeah, it's kind of like having 3,000 neighbors.
Yes, that's right. If you're doing something naughty, it's not so great. But
which you don't know from experience.
That's right, I do not. But if you need people, there's people around to help you.
So you mentioned your deck. Is that your favorite place on Bowen Island?
I love walking the seawall out at Cape Roger Curtis.
Yeah.
Hanging over those, the little walkways with the
railing.
railing.
The one that's hanging off the
yes,
cliff.
That's my favorite spot. Just leaning over there, staring out to the ocean. I love that spot.
Lovely.
Yeah.
Is there anything else you'd like to add that I maybe haven't touched on?
Let's see. Driver program, lunch program. We have a connections program. That's the only other program that I wouldn't mind speaking about. We just heard, I hear in here, a lot of lonely people in Bowen that live alone, don't see anybody from Monday to Sunday.
Wow.
So we set up a program of volunteers to visit people in their home, not to do stuff for them, but to just play cards, look at a photo album together, have a cup of tea. It's not unfolding the way I wished, and I think that people are really reticent to put up their hand and say, I could use some company.
Yeah.
And so we've had volunteers want to visit, but we haven't had very many people want to be visited, and I know they're out there.
Yeah.
Now, we have had 3 or 4, and they've all went, oh, thank you, that was so fantastic, and they've become friends, and they continue to see each other. So, I just like that program to, if you know of anybody that you think would like to register to be part of the program.
Grab their hand and put it up.
Make them put their hand up. Yeah.
Well, that's it's a wonderful program because it is easy to get lonely as you age.
Yeah, somebody said to me, it's not my quote, but I love it, the pioneer spirit that attracts people to Bowen Island when they're young doesn't serve them well when they age on Bowen.
Uh-huh.
And I think that's so true. People come to Bowen and they want to live in the woods where they don't see anybody, and they're going to have a garden and this and that, and they just want to be independent. And but boy, when you're 80 and your partner's died and you're still in that house and you have no help and you're still in the woods, in the dark all winter, and your kids live in Toronto, it's a tough place to grow old. There's not a community center. There's not even a mall. My parents used to go to a mall and walk in the mall to get exercise in the winter. Yeah, there's nothing. There's nowhere to go really in the winter.
Well, yeah, it's not a very walking-friendly place for the elderly.
Yeah, where you're going to bump into, oh, Mary, hi, how you doing? Yeah, no. Anyway.
So, anything a little more upbeat we could end on?
Besides lonely people living in a cottage in the dark?
Well, I think we could, I mean, upbeat is I know how much the community appreciates this service you run here, and how hard you work at it. And you say you're in here from Monday, Wednesday, and Friday from 10 to 4, but I happen to know that it's kind of 24/7 for you.
It is kind of 24/7, so, yeah. I mean, that's one of the joys, Tim, of being in here, though, of why I haven't quit, is actually helping people access services that they had no idea how to get.
Yeah.
I mean, it really is, it's not rocket science. It doesn't feel like to me, but people go, wow, I didn't know that. I didn't know I could call them and get that organized for my loved one. And so I love being able to put things in place for people when they're feeling scared and vulnerable, and very rewarding job.
Once a nurse, always a nurse.
Yes, I guess so.
Well, this has been wonderful, Colleen. Thank you so much.
You're welcome.
And who knows, maybe we'll do it again for the
Health Center.
Health Center Foundation.
I can't wait to open those doors.
Okay. Thank you.
Okay, bye.